Congratulations, and it's a privilege to present this to you, the Sanctity of Life Award. Nobody deserves it more than you, Marie. Thank you.
Thank you so much. Thank you so very, very much. I'm really touched and so happy, so very happy to be here with such good people, and so impressed with the number of you who are here for this second annual event. It says a lot about your community also, not just about this ministry. So, Your Excellencies, Archbishop Naumann, Bishop Johnston, our CEO, Brad Heydrich, and his leadership team, and I'm very, very fortunate to have had such great hospitality from your mission officer, Matt Chemnitz. I can't say enough about him coming all the way to Philadelphia and to Washington, D.C. to do that video, just reaching out to us with such warmth and hospitality. Also, the committed staff of Catholic Community Health. I especially want to highlight those who are giving hands-on care. I know our sisters are here, but people who are actually living this witness at the bedside, sometimes, many times, the unsung heroes of what you do. The religious sisters particularly, I think, give such a witness with the deacons, and we're honoring the deacons tonight also because they, and of course with their wives, I think are the other unsung heroes in terms of the work that's being done in the church. But everyone involved in this ministry is critical to it. And that's what I'd like to address tonight. I'm so honored. I feel like I'm one of the least deserving of the honorees tonight. My colleague, Father Tad Pahalczyk, truly a legend in this area of bioethics. And he actually joined the NCBC a few years before I did. And I'm just so honored to be honored with him because truly superior in the work that he's done all over the country and all over the world. But I also, again, want to mention the deacons who are being honored. And these are the people, Father Tad and the deacons, truly deserving tonight of this award. I am partial to deacons. I will tell you I have, and priests, I should say, I have a brother Catholic priest who is now deceased, but I also have a brother who is a deacon, and he's been a deacon for 51 years. He was ordained, yeah, agreed. He was ordained in 1973 and is still going very strong in ministry every day. In fact, we just celebrated last weekend in Connecticut his 90th birthday. So very, very honored to be among these honorees and feel the least deserving of the honorees. Why, we ask, do we celebrate the ministry of Catholic healthcare, which is what we're doing this evening? That's what we're really honoring, Catholic healthcare. What makes Catholic healthcare unique? What makes Catholic healthcare as we live it here in Kansas unique? Catholic community health is a gift. It's a gift to this community. And we can begin with the fact that it's the only Catholic hospice in Kansas, and its outreach goes into Missouri. And forgive me if I pronounce that wrong. I'm a Connecticut native, a Connecticut Yankees. So, but the outreach through 10 counties is incredible. And this has been going on now since 1945 in terms of the ministry of Catholic community health. And the ministry is one of carrying Christ's healing touch into homes, into the many different areas that Catholic community health provides ministry. That's home care, skilled nursing care, memory care, rehabilitation, and hospice care. All of it done being faithful to the ethical and religious directives for Catholic healthcare services. And they are critical. And I know how important they are to this ministry and to the people who are actually providing that care at the bedside. But it comes also from the leadership, right down from Archbishop Naumann through the administrative staff to those sisters and other persons who are at the bedside. Adhering to these directives is critical because they do make a difference. And it leads us not only in providing top quality health care to those that we serve, but it's a witness because we serve all persons regardless of their faith and regardless of their ability to pay. So we're bringing Christ into the lives of patients and families and the community, which otherwise may not have occurred. I think the highest testimony to the quality of care and the Catholic mission that's lived out in Catholic community health is the fact that, as we've just heard, that Archbishop Naumann has great respect for, and actually is, because it's an archdiocesan ministry, which is a great thing, great support of this ministry. But more than that, he entrusted his own mother to the care of Catholic community health. And that's quite a testament to the care that's provided there. But why do those of us involved in Catholic health care do what we do? Why do we not just rely on the local community, secular community that provides quality health care? What is the difference that we make? And I hold that Catholic health care, particularly Catholic community health, is not only unique, but it is indispensable to the community. It is indispensable to the well-being of society. Catholic community health has made a commitment to make Jesus Christ present in the community and present in the rooms that are being occupied by people who may not have had any contact with Christ throughout their whole life, but yet might be dying and facing their Creator. So people who may have no faith at all have the benefit, as do people who have great faith, of this ministry. Because as we know, every person, every human being is a citizen of the people of God. From that patient I talked about in the video that I cared for in the veterans' home who was dying, to someone who might be quite healthy and even able to care for others with great professional faith, every one of us, regardless of that, whether we profess it or not, is a member of the citizen of the people of God. It is a response to this mandate that we recognize the humanity and divinity that's within each person, not that we are divine, but we're made in the image of God, that leads us forward in the work that we do. And all we have to do is look to the parable of the Good Samaritan, in which we were admonished, to love our neighbor as ourselves. And Jesus tells the story when he tells the people who are listening to him that we must love our neighbor as ourselves. He was challenged by a scholar of the law at the time, asking, who is our neighbor? And that's when the parable of the Good Samaritan was given to us in the Gospels. And Jesus tells the story of the man who had been robbed and beaten and left by the highway, and no one to take care of him. And the Levite and the priest of the temple walked by and did nothing. And the Samaritan, that was really a looked down upon sect by the Jewish people. The Samaritan stopped and he bound the wounds, cared for the person, and brought him to an inn and paid for his care. And Jesus then asks, well, who was the neighbor in that situation? And of course, the answer was the Samaritan. But the important part of that parable is Christ said, go and do likewise. And that's what we do, even to the stranger. That's what our commissioning is, our commissioning in Catholic health care. Go and do likewise, recognizing that every neighbor, and even those who aren't really our neighbors, the stranger, is a citizen of the people of God. And we're called to love them as ourselves. This is a radical type of love, different from other healthcare that we witness, as good as it may be. It's sacred because the human body made in God's very own image, is sacred. And Jesus has sovereignty over it. Nothing can violate that, not at the beginning of life, not through the factory-like distortions of the sacred acts that engender new life, not through the mutilations of the sacred potential encoded in our very sexuality that is being mutilated now in our society and in healthcare, and certainly not at the end of life, which Catholic Community Health knows so intimately. Catholic Community Health does not abandon those at the end of life to the euphemism of death with dignity, in which dignity is assigned by others, not recognized as innate by the very fact that we're made in God's image. This sacredness is what the ethical and religious directives for Catholic healthcare services protect. They are distilled from the Catholic Church's teaching. The moral teaching, theological teaching over the centuries have been distilled into these ethical and religious directives. And they are updated regularly since 1919. The bishops of this country, through the U.S. Conference of Catholic Bishops, update these directives to respond to the fact that the technological advances are outpacing the necessary moral analysis that must accompany these new technologies. And that's what these ethical and religious directives do for us. And that's why Catholic healthcare is so critical. Catholic healthcare creates the difference between secular healthcare and Catholic healthcare with this radical type of love that is fostered by the ethical and religious directives of loving one's neighbor as oneself, even with these wonderful advances that sometimes are actually violating that human dignity and that human integrity. Pope Francis, in a letter entitled Samaritanus Bonus, which is the Good Samaritan, on the care of persons in the critical and terminal phases of life, admonishes, and I quote, not to underestimate the full human potential of presence, of availability, of welcoming, of discernment, and of involvement, which nearness to one in need demands and which is essential to the integral care of the sick, end quote. It's about presence. Catholic Community Health not only lives this, but recognizes that it's a privilege. It's a privilege to be present. Any of us who's had the privilege to be at the bedside when one walks into the arms of God, as I have, and I'm sure many in this room have had, knows that it is a presence that is a privileged presence, that we make a difference, as Pope Francis describes our ministry, and helping those prepare for eternity, for which each of us has been made, even with those who may have lost their way for a time along the path, is the greatest privilege of all. It's a privilege for our clergy and certainly our deacons whom we're honoring tonight, as well as all of us involved in health care. Every member of Catholic Community Health shares in that sacred ministry. And that's what makes you and all Catholic healthcare different. That is why we exist, to help each other on the journey to eternity. And that is why we are essential to the human family, to be present to those in need with this radical love. I am truly honored to be associated with each of you as part of the family we know and love as Catholic Community Health. Thank you very much for including me as part of your team.